Thank you. Good afternoon. I'm State Representative Tom Demmer from Dixon, and like Representative Welcher, I also represent part of LaSalle County. As we begin to evaluate this tragedy and seek answers to what happened or didn't happen and when, it's important that we review the timeline of events as they unfolded over the past year plus. So first, let's remember that this public health emergency began on March 5th of 2020, after Illinois had its first confirmed case of COVID-19 on January 24th of 2020. During that time, every industry and every person's lives in the state of Illinois were changed dramatically, and 95% of our attention every day was on COVID-19, what to do to protect ourselves and our loved ones from the public health emergency, and what steps we should take to ensure that our communities would be safe. On November 1st, the first case was reported at LaSalle Veterans Home, 282 days after the state of Illinois saw its first COVID-19 positive case, and after months and months of dramatic and life-altering recommendations had come down from global, national, state, and local health authorities. 1 week later, 60 veterans had tested positive and 43 staff members had tested positive after the beginning of that outbreak 282 days into the COVID-19 circumstance in Illinois. Yet on November 10th, 9 days after that outbreak began, Governor Pritzker said, "Our Veterans Department has really done an outstanding job of keeping the veterans in our veterans' homes safe." A November 12th report from the Illinois Department of Public Health, however, found the real story. The report said, during the first 7 months of the pandemic, the management team and staff did not anticipate and were not prepared for an outbreak. 282 days into a public health emergency that changed everyone's lives, the management and staff at the Veterans Home did not anticipate and was not prepared for an outbreak. That is a clear failure of leadership. That is denial. That is total chaos and confusion. The governor, claiming that the Veterans Affairs had done an outstanding job, covered up the fact that 2 days later, a report found that they were not prepared, and they did not anticipate that circumstance. The report issued by the Inspector General at the Department of Human Services painted a clear picture of negligence. But what it didn't show is why the governor's office and the Department of Public Health failed to act when they knew an outbreak was ongoing, or when they knew that individuals in congregate living facilities were at a much greater risk of negative experience due to COVID-19 exposure and contracting of the virus. We as a legislature must assert our ability to be a check and balance against the executive branch, and we must conduct hearings to understand what happened, who was notified and informed of the outbreak, of the lack of preparations in the Veterans Home during a public health emergency. It's time for us to hold hearings, to invite former Director Chapalavia, to invite current Veterans Affairs Director Price, to invite current Department of Public Health Director Ezike, and any individuals in the governor's office who are responsible for overseeing the Department of Veterans Affairs and the Department of Public Health. The people of Illinois demand answers. We must conduct legislative hearings to provide those answers.